Okay, so for the knee eval assignment, I did a knee eval on Tuesday with a football player at Grinnell. So ran through it, came in and he was complaining of posterior lateral knee pain. Um, Not a ton of pain. It was really what it was. It was like a leftover symptoms from an injury that he sustained like a little over a month ago. That he was still just having symptoms with, and he was just like a little concerned about it. So looked him over, history. Initial injury was like external rotation of his knee, like forceful external rotation, or forceful external rotation at the hip with the knee at like 90 degrees. So putting stress kind of like through that lateral knee, that LCL area. Really, initially, had pain with it. He never had to sit out at all. It, excuse me. It just hurt a little bit. So kept playing on it, and then the football season's over now. It's been over for 2 or 3 weeks. And he's just like still feeling it a little bit, so he came in to get it checked out again. So looking him over, palpation, not much popped up on palpation. He had some discomfort kind of behind the fibular head, kind of like where the hamstrings, LCL, all kind of connect to. But so he had oh my god, some discomfort back there, but not a ton. Um, Other than that, LCL was clear. Anterior knee was clear, medial knee was clear. So it was really just that one little spot, and you really had to dig in with it to actually get it to light up. If you just touched it with like some pressure, nothing was really there. So going on from that, manual muscle testing, just did quads and hamstrings. Both of those were equal to his unaffected side. So nothing showed up there. On from that, for special testing, I just did valgus varus stress testing at, full extension of his knee and then slight flexion, that 0 and then 1 and then 30 degrees. Those both came back as negative. And so from that, kind of determined that it's either like just that LCL is, with the testing is no symptoms, but with just like pressure, it still hurts a little bit. So still a little bit of like an LCL strain that just hasn't quite gone away yet. Or I talked to my preceptor about it afterwards, and we were also thinking it could be a posterior lateral corner injury of some kind that just hasn't healed yet too. So, but from what we talked about, it would be hard to tell like exactly what had happened to that posterior corner if it was something besides LCL or like hamstrings. So comprehensive, I think for what it was, I think I was comprehensive, maybe not as much as I should have been, but enough that we got what we needed out of the eval. Did all the palpations around the knee, it's just like that was only that one spot, palpated posterior knee, anterior knee, hamstrings, calf, patella tendon, meniscus, all that. And like none of those came up, just that one spot, like posterior to that fibular head is where his pain was. Also didn't do any range of motion, mainly because during the history, should have mentioned this earlier, during the history, the patient basically went through his own full range of motion. He's like, yeah, it only hurts when I do this. It doesn't hurt when I fully extend or fully like flex my knee. And he would just put himself in the full flexion, full extension. They're like, well, don't think I need to do that. So maybe I could have done that anyways. I do think that the eval led to a confident diagnosis. I don't think I missed any key information. So I'm pretty confident that I got everything I needed to with the special test and then palpation especially. And like also, if it does end up being a posterior lateral corner injury, it'd be super hard to tell without imaging exactly what it was. But I think with the information I gathered, I'm fairly confident on that diagnosis. Did I incorporate evidence into my eval? Yes, with valgus varus stress testing, those are fairly good for testing LCL, MCL. I didn't get anything with those, but because of symptoms, I also still included the LCL. But I did use those because if it was a bit more of a serious LCL injury, I think he would have had a lot more pain, or he would have had pain with that instead of just the palpation. What did I do well? I think the history and palpation I did really well with. I only did the 2 special tests, valgus varus, but I do think I did those very well. I felt confident doing them. Felt good about areas I can improve. Definitely should have just done range of motion anyways. So really just like making myself do a full eval, even if I don't think it's important, like this one was. It's like, just do it anyways. You never know, so yeah, that's the knee eval reflection.